clinical supervisors sometimes make mistakes when they are training people on documentation. That is totally understandable, but I want to help you avoid making those mistakes. So in this video, I am giving you a little glimpse of what's inside stress-free documentation for supervisors, my newly revamped online course. So we're going to go through a few of the common mistakes that we see. Now, this is a module I will actually be updating, so you are getting a glimpse of the older course, which was called The Art of Teaching Documentation, and we're totally revamping it. So check out these 3 points will be in the upcoming course, along with some updates. Let's go ahead and dive in to check it out.
Let's dig into some common mistakes of supervisors. And you will see that all of these common mistakes, they're not big actions. They are typically a thought or a thought process. So we want to reevaluate all of these and make sure that, I want to make sure I bust a lot of these myths right at the beginning so that as we get started, you have a different mindset going in. So common mistake number 1 is thinking they're already licensed. They don't need any training. Au contraire. So one of the big lessons here is never, ever assume. Unfortunately, this is something I have seen quite frequently. And so you may think, oh, well, I'm working with this clinician, or I just hired this clinician and they must know how to document, or they've been working for the last 10 years. They've been writing notes for more than 10 years. I don't need to worry about that. And unfortunately, that is not the case. That has not been my own experience when I was training clinicians or when I was a manager. So you always, always, always want to provide a training on documentation specifically. I mean, obviously on other things too. And so I would apply this to clinical aspects and other things as well. But please just never, never, never assume that your therapists have had any type of training and documentation, or even that they've been doing notes, depending on the setting they've been working in. I know it can seem a little crazy to some people, but it's true. Okay, common mistake number 4 is the thought, this is how I learned and how I do things, so that should work for them too. Unfortunately, what I have found is that actually things like writing notes, things like managing your time, things like when you see clients, how many clients you see in a day, all those different things are very individual. And it's not simply a preference. It is often a personality thing or a characteristic thing. And that's great because that's what gives us diversity. And that's why, you want a team of people who are diverse and can offer different types of services to people, right? So that's why you want to really think about anytime you have the thought of like, well, this is how I did it, or this is how I learned, or isn't this how everyone learns? Any thought like that should be kind of like a red flag, like a little check to yourself, like, wait, is that true? Or, why am I thinking that? Because oftentimes it's probably not the case. So really opening taking a step back, taking time to open ourselves up and think, okay, is there a better way to do this? Is there a different way to do this? Maybe even not better, but just a different way that this clinician could do this task, or that I could help this clinician do this thing. And that will, oh my gosh, it'll help you so much to take that time to kind of step back and consider that option. Because you want to have people working under you who are different from you. And that means that they're likely going to need to learn differently too. Our 5th mistake is thinking they'll ask for help if they need it. Unfortunately, this is also not the case. And I literally put this slide up here again because I think it's that important. Never assume that because someone is not asking you for help or is not asking questions that they know what they're doing. Really, this is where you should be able to trust the data you have. If someone's notes are really behind, if someone's notes seem kind of poor or kind of short or whatever, they probably are. And even if that person is not talking to you about it, they are probably struggling. Unfortunately, one thing I have seen is that a lot of therapists have had a negative situation with a supervisor in the past around documentation, and it often trains them to not ask for help. So you absolutely do not want to continue that pattern if someone has that. And unfortunately, because so many clinicians have been shamed around this area, they often will not bring it up unless you do. So make sure that this is something you're talking to your staff about consistently, and always bringing it up with new people or if you're in a new role, because they may not bring it up to you. Another thing I know, when I was a manager, no matter how many times I told certain people, like, oh, you can call me anytime, you can text me anytime, made it as easy as possible for them to contact me, they would just wait until our assigned meeting time to bring up issues, even things that I thought were kind of important that they should have brought up sooner. But, and I got to recognize that that's just how certain people work. And so I needed to make sure that I was kind of on top of checking in with those people. So never assume because someone's not asking that they feel confident. All right. So for this lesson, I want you to kind of reflect on your own training. What were the things that were helpful or maybe negative experiences you had around documentation? And then, take just a couple minutes to write down any of those preconceived notions you might have about your own supervisees. And then you might see some correlation there in how maybe you were trained one way and that worked for you and it's not working for someone else. So really kind of trying to think outside the box here, especially if you do have any of those preconceived notions about your supervisees. All right.
Thanks so much for watching. I hope that was helpful. Let me know in the comments below, what are some common mistakes you have seen your supervisor make, or maybe that you have made as a supervisor. Let's share and make sure that we are improving the profession and improving ourselves ongoing. And if you want to check out Stress-Free Documentation for Supervisors, the new online course, go ahead and click on the description below and you'll be able to access that. Thanks for watching and happy writing.